All right. Thank you, everybody, for taking time out of your schedules to join us here today for the Penny Broker Lunch and Learn. We are recording this session, so please be advised that if you're here and don't want to be recorded, you'll have an opportunity to catch up with us on the other side when we post this to Penny's YouTube page. I'd like to welcome Greg Gutierrez. He is with the Independence Blue Cross CHIP program, and he's a partner with us, a community partner here at Penny. He's got a lot of great information to share with you with regard to CHIP and on a broad level, how CHIP can help children in the Commonwealth of Pennsylvania get protected. And with that being said, I'm going to turn it over to Greg. Please understand if you have any questions as we move through, you're more than welcome to unmute yourself. And Greg, please feel free.
Good afternoon, ladies and gentlemen. Thank you so much for your time. I really appreciate the generosity of your time because, as we know, everybody is very busy. And today, what I'm going to talk about is the CHIP program. Now, as you see, the presentation we have is geared from southeastern Pennsylvania. I'm out of Philadelphia, Independence Blue Cross, and it is geared from our product. But what I'll be talking about is the general overview of the CHIP program. Okay, so some things are going to be a little different in your area and with your carrier, but the basic structure of the program and its requirements are all going to be same throughout the state. And so with the agenda, as you'll see, we'll talk about the program overview, answer the question how your child can enroll, some plan and coverage details, and most importantly, how to apply. And throughout the program, what I'll do is also I'll gear it a little toward, I will gear it towards you and your clients. How will this help my clients? How will this help me? What is the payoff if I have some of the people off an employer plan going on CHIP? What's the advantage of it? And we'll go through that. Okay. One thing I want to say up front is that with CHIP, there is a misconception. A lot of people think it's a type of Medicaid program. It's a program for people with lower income resources, but it's really for families like you and I, working class families who have an income. You have to have an income to qualify for CHIP. Now, as we'll see through the steps later on, the different income just gives you different levels of premium from zero up to full cost. So you have to have an income. There is a floor with CHIP. If you go below that floor, most likely you will qualify for some type of assistance from the state. If you go above, there's no ceiling. You can make up to $1 million and still put your kid on the CHIP program. And it might be cost effective too, as we'll see. Sorry. Okay. So, like I said, this is from Independence Blue Cross, but your carrier region will have a CHIP program, and most likely it'll be an it'll be a HMO program, and you'll have access to the doctors that are in that program. So you'll have access to the doctors and the network and the hospitals. Here in Philadelphia, we have a large network, and we have all the major hospitals in our region that participate. So one thing to look at in your area before you put one of your clients on CHIP is have them take a look at the network also for whatever carrier you're using. Because that's, as we know, that's very important, especially with the younger kids. With the pediatricians, you want to make sure that the pediatrician is in the network. So let's get started. So what is CHIP? It's Children Health Insurance Program. It's a state and federally funded program. And what that means is that it is funded by the state to keep the premiums down. It's subsidized. And it's eligible for kids from birth up to the age of 19 who don't qualify for Medicaid or Medicare. As you know, if a child qualifies for Medicare, most likely they're disabled. And it's better if they're on a Medicare type plan or medical assistance than CHIP, because those plans would have no cost or very low cost. Depending on income, you could have co-pays for your services. And it's very comprehensive. So the CHIP program does cover medical, dental, vision, hospitalization, doctors, therapies. It's a really comprehensive program. Most people think when they hear anything subsidized by the state, it's cut rate, but not CHIP. Very comprehensive. And as you'll see, you're probably thinking, wow, do they have this for adults? But the good thing is it'll protect your kids. And your monthly premium, as I said before, will depend on your household size and income. So if you look on the right-hand side there, the good thing about CHIP is there are no deductibles. So as you know, because of the pandemic, maybe some employers have gone to a high deductible plan to be more cost effective. But with CHIP, you don't have that option. It's strictly co-pays. So some people may have a high deductible plan through work and wondering, why am I getting this taken out of my paycheck every 2 weeks to pay for this health plan when every time I get medical services for my child, I had to pay out of pocket anyway? With CHIP, strictly co-pays. Now, CHIP is good if you've lost your job. And as we know, COBRA can be very expensive to add on the whole family. So what you can do is as the employee, let's say mom and dad, can stay on the COBRA plan through the work, and you can put your kids on a separate CHIP policy. That's allowed. Also, let's take the scenario of someone who's in retail. It's summertime, so the hours are low. Maybe they're not working a full 40. Maybe they're working 35, 36. In their income, they can qualify for medical assistance. But come the fall or come Christmas, their hours shoot up, they're getting overtime, so the income is going to bump up. You can put your kid on CHIP. And the good thing about CHIP is that you do not have a contracted period. So that scenario, like someone maybe is lower income during the summer, you can have a medical assistance. Their income raises, they basically income out of any type of assistance program, you can put them on CHIP. Same thing if someone is on COBRA. So like I said before, the kids are on CHIP, the family's on COBRA, unemployed. I find a job in 2 months. It's a great health plan. I can take my kids off a CHIP, put them on the employer plan. There's no contract period. You can have it for 1 month, 1 year, however long you want, and that's fantastic. Also, there is not an open enrollment period for CHIP. So let's just say now that you have someone on a group plan and adding their kids is very expensive. And they have the option to maybe drop off their kids during the year or an open enrollment period. They can drop them off whenever they want. I mean, they can drop them off the group plan and apply whenever they want. And it's good right now as some of your clients may be coming up on an open enrollment period towards the end of the year to take a look at this. So let's say that someone's open enrollment period is now for the start of October 1st. They can have a look at the CHIP program, how much they would pay, do the numbers, and they may think, hey, this CHIP program is really going to work out for me. They can apply now on the application. All you got to put start date of October 1st. October 1st, you'll have coverage with CHIP. So the requirements, they must be under the age of 19. So as soon as they turn 19, they'll be put off the program. Now this pertains to us here in Philadelphia. They must reside in our service area. It'll be the same thing in your area. Whatever insurance carrier you'll use, they'll have a service area and they must be in that service area. Must be a U.S. citizen, must be a national qualified alien. What we're saying is the child must be documented. Now here in Southeast Pennsylvania, there's Chester County, mushroom capital of the world. They have a large immigrant population. We do a lot of work with them. Now, sometimes the status of the parents is not clear. That's okay. As long as the child is documented, they can apply for CHIP. Now, it's a big help for some of those families where they're thinking that, well, my status isn't clear. My kid can't get coverage through a plan that's subsidized through the state. No. As long as the child is documented, then they can apply for CHIP. And that usually means they'll have the residency card. Now, there's also certain caveats, such as they'll have special visa, such as if they're a refugee or have refugee status, things like that. But that's very rare, but those statuses are there. Of course, they can't be eligible for Medicaid or Medicare. If they're Medicaid, their income is too low for the program. Medicare, like I said before, they're most likely disabled. And the last point, like I was saying, as long as they can leave their present coverage within 60 days. Basically, what we're saying is that as long as in the application, you can put an end date on their current coverage. So I used the scenario of open enrollment. On the application, you would have put September 30th as the last day of coverage, start date for CHIP, October 1st. So you can apply well in advance. Okay. So with most CHIP plans, your child's well visits are going to be covered at zero cost. And for the babies, that means all the immunizations, the shots they need in the first 2 years. Also, the well visits includes your dental and include your vision. Those annual checkups will not have a cost. Okay. So most likely you'll have an HMO in your area. You'll have to choose a primary care physician, standard. Also, when you visit your primary care physician, remember, all you're going to pay is just the copay. Now, with us here and with the Blue Cross plan in Southeast Pennsylvania, we've had zero copay for inpatient, outpatient behavioral health. That's very important nowadays. Check with your local carrier about their CHIP program. They might have this also, or most likely, as you'll see, the copays are going to be very low for that type of service, which is very important nowadays, especially with the pandemic. A lot of kids are needing some type of therapy. Also with us, the emergency room copays are waived if you're admitted. With your plan, your copays are going to vary, but as you'll see, they'll be very low. Now, keep saying monthly premium. It's going to range on family size and household income. Now, when we say household income, it's whoever was working in the family that can claim the kids on their taxes. So let's say you have mom, dad, grandma. Now, grandma provides a lot of assistance to mom and dad. Maybe they're paying for their tuition, they're giving the kids money for school clothes, things like that. A lot of people think that we count her income. She's part of the family, she's in the household. No, you don't. If mom and dad are claiming kids on the taxes, then it's just mom and dad income. Also, in cases of divorce, let's go standard. Most likely the father is charged with paying for the children's health coverage. Then you would go with his income, even though they're living with mom. And the mom, let's say it's two, claims maybe one, he claims one. That court order, we go by his income because he has to pay for both the kids' health coverage. Now, you'll have different levels of chip costs. And there's free chip, which means that you qualified at a certain level, that there will not be a monthly premium. And also, with our plan, you'll have no copays for any of your medical visits. Now, as you see here, the different levels of chip. So that's all that means is that your income has risen. So you'll have a low cost of maybe $45, $93, and $106 a month, and this per month per child. And there's full cost, which means that you reached a certain threshold where it's full cost. The higher you go, does it get more expensive? No. $1 million, $80,000, defining your family size, you're still going to pay the full cost. Now, one good thing to realize is that just because you're paying full cost doesn't mean you're getting more benefits than if you paid zero. On the CHIP plan, everybody gets the same robust amount of benefits, same network, same services. The only thing that's going to vary from plan to plan is going to be the copays. Now, with us here in Southeast Pennsylvania with Independence Blue Cross, if you have a family with a large family, let's say 5 kids, you're only going to pay for the first 3. So again, large family with us, you're only going to pay for the first 3. And that's a huge money saver throughout the year. Now, as I said before, as you see at most CHIP plans, your copays will be very, very low. Now you'll have free, which means exactly what it says, no copays for any of your medical services. and you're only going to pay copays when you get medical services. Then you'll have low cost. Remember that middle section, chip 1, chip 2, chip 3. Even though you're paying a different monthly premium, you're still going to pay the copays that are low through chip 1 through chip 3. So as you see, $5 for a doctor, $10 for a specialist, $25 for emergency room visits. Now, your local plan, of course, the copays are going to be vary, but I'm safe to say, guarantee, there'll be some of the lowest copays you'll see around on any health plan. Now, even on the full cost, you see the copays are still very reasonable. 15 for a doctor, 25 for a specialist. It's hard pressed to find that anywhere nowadays. And no deductibles. As we keep stressing, no deductibles. A lot of health plans, just to be cost effective, or maybe smaller groups going to high deductible plans. You see with us, you're just paying copays when you get medical services. That's it. Now with us here, hospitalization is covered at 100%. So heaven forbid that your child has to be overnight in the hospital. The labs, the x-rays, the therapies, the surgeries, the radiology, whatever they're getting while they're overnight in the hospital, there's no out-of-pocket cost. As long as the services are medically necessary and pre-authorized, they'll get covered at 100%. And that's a huge money saver and a great peace of mind for any parents. And that'll be the hospitals that are in the CHIP network. So like most standard HMOs, there's no coverage outside of the network except in case of emergencies. So that goes with CHIP. Okay. Now they all include pharmacy. Again, no deductibles on your pharmacy plan. You'll have low cost copays for your pharmacy plan. Here in Southeast Pennsylvania, all the major players such as Rite Aid, Walgreens, CVS will be in our network. Your area, most likely all the major players will be in the program also, and you'll have low cost for your medications. Now again, as you see, if your family qualifies for free, it's a zero copay. Now with us here, we do have a special option, which is the mail order. So if your child is on a monthly medication, just say asthma, they need an asthma inhaler every month. They can get 3 months worth of supply for only 2 months worth of copay. So that's a huge money saver throughout the year. So it's a low cost, full cost with us, 3 months worth of supply for 2 months worth of copay. And there's no limit. So if you have 7 kids in the house, pertains to all of them, which is fantastic. Also, each company that does the CHIP program has a formulary, just like any other health insurance company. It has a formulary. So before a family applies, always advise them to check their formulary, make sure the medication is covered by the plan and is covered by the carrier. Okay. Now, of course, we have some health safety nets for your child. As we know, unfortunately today, some kids can be over medicated. You're taking your child to one doctor and another doctor, and sometimes, unfortunately, it's not communicated what one medication is being prescribed as another medication is being prescribed. And that can have a negative impact on your child. So we do have prior authorizations, age and gender limits, quality level limits. All these are this stopgaps to make sure that your child is being prescribed accordingly to FDA guidelines. It's appropriate for their age, for their size, for their weight, and we just want to make sure that there be no negative consequences. And even on the 96-hour temporary supply programs, what that means is that if your child's on a medication where it has to be reviewed and they're out of it and it's necessary for that child to be on that medication, they can't skip a day, they'll get a 96-hour supply while that medication is being reviewed for coverage. Now, all CHIP plans do include dental. So you'll have one every 6 months, you'll have your dental visits covered. So the x-rays, the cleanings, the fluoride, all that's going to be no out-of-pocket cost. Extractions are covered, fillings are covered. Basically, anything that will have to do with any of your oral health for your child, it'll be covered. Here, those things will be covered at 100%. Anything else, there may be a copay. What's important is you see here, orthodontics, braces are covered at 100%. I wish my kids could get this. I mean, braces are going to be covered at 100%. What's going to happen is that it has to be medically necessary. Just can't be cosmetic. If it's medically necessary, you'll have no out-of-pocket costs for your child's braces. And we use here in Southeast Pennsylvania is United Concordia Dental. It's a PPN network, which is fantastic. So a child can go to any network they want. In your area, the dental network may differ, so just check with your local carrier. Also, vision is included. As you know, the little ones sometimes need glasses. It's very important that they get their annual vision checkup. This is something I see when I travel to the schools in the area. Um, this is just something that's just skipped for whatever reason. So it's very important. It's included in the program, and their annual eye exam is going to be covered at no cost. Now, for us, we use the Davis Vision Collection here, and you get a $130 allowance towards your lenses. Or if you use a certain collection, there's no out-of-pocket cost. So the allowance is if you have a little fashionista and she needs those $200 pair of frames, you're only going to pay the $70 difference. Let's check with your local plan, see if they have this, if they have that option. Also, contact lenses are going to be covered also. So if they're on the formulary, there's no out-of-pocket cost. Again, you still get that $130 allowance. Now, with all chip providers throughout the state, you're eligible to get the 2 pairs of glasses or 2 pair of contact lenses within the year covered at the same cost. Meaning, especially with the little ones, that if the first pair is lost, broken, or maybe their prescription changes throughout the year, you're entitled to get another pair at the same price for whatever you paid for it. So if it's $200 and that's what you paid, then you'll get the $200. Or if it's within, say, for example, the Davis Vision Collection, there'll be no out-of-pocket cost. But that's very important, especially with the little ones who tend to lose or break their glasses. So that's fantastic. Yep. And this is just showing that most likely the add-ons that you need for your lenses, such as polarized anti-reflective coating, their copays are going to be very low. I'm getting glasses now. Some of these add-ons are more than $100, $200 for what I need. So this is very cost effective for your children. And also there's no limit to the amount of glasses that a family can get throughout the years. If you have 7 kids, you can get 7 pairs. And that's the good thing about the CHIP program. They don't have limits like that for a family. Like I said, 7 kids, 7 pairs of glasses. If it's included in the program, it's going to be covered. Okay. Now with us, what we have something important is called health coaches. What they are is they're nurses who a parent can call. Let's say your child has diabetes. You can call one of these nurse health coaches, figure out a diet plan. They can look over your medication, make sure you're being prescribed correctly, or maybe bring up a topic that maybe you just didn't realize that you should have brought up with your child's doctor. Parents find this very, very helpful to talk to these nurses, and really it's an extra layer of protection, and it really gives a parent a feeling of satisfaction that their child's being taken care of. And with our program, we have IBX Wire. So what that means is sometimes, well, not sometimes, that you'll get text and emails regarding a renewal process or plan updates, and also we provide discounts with it. Okay, so I'll go through this quickly. Basically, what we're saying, all chip programs is going to be standard. There's nothing really unique about it, except maybe the as we go through the financial process, but it's standard. If you need a referral to go see a specialist, just like a regular HMO, you will. Some services need to be authorized. You have to do that. It's standard. Okay. Also, there's a complaint and grievance. If for some reason one of your clients has something they don't agree with, a decision, there's a process to do that. Also, exclusions, of course, like any standard insurance policy, there are going to be some things that are excluded, such as anything strictly cosmetic or anything that's just experimental. That's not covered in most policies. And also, you'll get a handbook. It'll have a whole list of what's excluded and what is covered and what is not covered. Okay. For us here, you can call the insurance Independence Blue Cross directly and do an application over the phone. Maybe the same thing in your area. Check with the carrier. We have language lines, so if language is not the first, I'm sorry, if English is not the primary language spoken in a household, call the rep, say Russian. They'll reach out, get a Russian interpreter, and you can do an application over the phone or mail it. Go to our website, download the application. And I'm sure everybody's familiar with Compass. You can go through that also. Here, you can contact me directly, be more than happy to help, more than happy to speak to families, to walk them through the process. In your area, most insurance companies will have a CHIP representative that'll do the same thing with them. So let's just say I know Capital Blue Cross. I'm sure they have a CHIP representative. If you have questions, you can contact that individual. Now, I'm just going to go back to this right here. Oops. Okay. So enrollment. What are some of the hiccups that we see when somebody wants to enroll and their kid in CHIP and it's just not flowing clearly through the system? Well, obviously, verification of income is important. So what we recommend when you do an application, they'll look for your last two pay stubs. To speed along the process, we would recommend that you send in your client's last two pay stubs. Also, a lot of times what people do is they have a part-time job, say last year. If that's so, with the application, just write, I left ABC company part-time job March. Because what's happened as we're verifying income, what they'll do is they'll go out to databases. Let's just use Department of Labor. They'll see your primary job and also your part-time job. And assuming that those two jobs are still active, so your income will come in higher, you'll pay a higher rate. Also, if you left an employer, same thing. They'll go out to those databases. They'll look at that and say, well, this guy's working two full-time jobs. So your income might come up to, say, over $300,000. And you're like, what? So if you left any type of employment, it'd be speed up. You just put down, I left ABC company March 1st. If you can get it on your company's letterhead that you left, fine. If not, a handwritten note from yourself would be helpful. If you're self-employed, what they want to help verify income is your last tax return. So let's say you didn't file for 2020 yet, then that would be 2019. And what they want is the whole tax return. What a lot of people do is just send the first 2 pages. No, they want the whole tax return, every single piece of paper that you filed with the government. They want that, and they need that as proof of income. Now, let's use a scenario again of someone in the retail business. So let's just say that as summer is winding down and fall ramps up, income goes up. They may be on CHIP. They go at a higher level because the income has increased. They're just going to pay more. Okay. March, maybe hours go back down again. They can simply write in, ask for income review, send the last two pay stubs, and they'll be put at the appropriate level of the CHIP program. Now, also, there's a COBRA for the American Rescue Plan. There's a COBRA subsidy. So what will happen is that you can put your kid on CHIP. Right now, there's no open enrollment period. Like I said, even right now, if you're the subsidy's ending and you can't afford it, COBRA, you can apply now for health coverage through the marketplace. You can do that right now with CHIP. You don't have to wait. Will my employer be penalized if my child goes on CHIP? No. As we know that if an employee is offered health coverage to work and they still choose to go through the marketplace to get health coverage, again, as we know, there's certain caveats. The employer may be penalized. That's not so with CHIP because the kid does not have to join the employer plan. So that's not a worry also. All right, so what happens when the subsidies end? How much will they be charged? Well, it'll be based on their annual income. So right now, a family can't afford to pay their CHIP premium they're on right now. They're not, we cannot kick them off the program for non-payment because of the rescue plan. So what will happen when that subsidy ends? It'll be based on their current income. Okay. Now I'm just going to jump to another PDF, and I'm going to share this just to give you an idea of. Whoops. Hold on. Just to give the idea of the financial guidelines that we use when I mention that. Okay. So it's very simple. You'll say a family of 4. You'll just get through the various incomes. So a family of 4 whose household income is between 55 and 69 with us, they'll qualify for sub-chip 1, which means they'll pay $45 a month. Now, the financial guidelines will be the same throughout the state. What's going to vary is the amount of money you'll be paying per month per child, because every insurance company will have their different monthly premiums. And as I said before, if you just go above a certain threshold, you're going to pay full cost. You're not going to pay any more. You're going to pay for us $340 or whatever your carrier is charging. So, all right. So hopefully that was helpful for you. Again, thank you so much for your time. I really appreciate it. Thank you for Scott and everybody at Pennie for this opportunity. He'll have my contact information. Any questions, please feel free to reach out. And also, happy selling. Best of luck for the rest of the year. Thank
All
you.
right. Thank you so much, Greg. And it is good to know, especially in this day and age, it's good to know that there is no reason why any child in the Commonwealth of Pennsylvania would not go without health insurance and the protection that it affords.
Yep.
And when you think about CHIP, what's so unique about it is it's really a perfect package. It covers the health insurance needs, it covers the dental, it covers the vision. It makes sure that if anything else, those children in the Commonwealth who need to be protected get protected. So thank you for the work that you do. Again, folks, if you have any questions, Pennie has a no wrong door policy. So if you refer somebody to Pennie and we work with that customer and we work with you as a broker, we will make sure that if that individual needs to be connected to CHIP, or to Medicaid, either one, that they are connected so that they get the help that they need and the protection that they need now more than ever. So, Greg, thank you again so very much. This will be made available through recording, and we will share it with our broker network. And thank you so much. You have a great afternoon and stay safe, okay?
All right. Thanks, Scott.
All
Be
right.
good,
Thank
everybody.
you.
Bye-bye.
Bye-bye.